Hi, good afternoon. My name is Dr. Mohammad Fawad Ali. I'm a consultant physician practicing at UDAI Omini Hospital, Abbots. So, the recent surge in viral illness, flu-like illness in the entire country, especially in Hyderabad, can be attributed to influenza virus. It's a type of influenza, a subtype of influenza A virus, H3N2, which is also called as swine influenza virus. So we are seeing a lot of cases of lately with cough, fever, cold, joint pains, headache, and some cases which are at high risk are children below 5 years of age and elderly population and immunocompromised population. The complications of the virus, it is usually a self-limiting disease. It gets over in around a week, but at risk population has the they can get complicated. The major complications can be developing into pneumonia, myocarditis, myositis, and ultimately at-risk populations, immunocompromised people, pregnant females, children below 5 years of age, and geriatric populations, can have fatal complications as well. So the most important thing is to stop the spread of the virus. The spread of the virus can be stopped by maintaining proper sanitation habits, washing your hands, wearing a mask, avoid going to crowded places, wearing a mask always in crowded places. And the most important protection we have is vaccination. At risk population is supposed to get vaccinated every year for the influenza virus. And the most important thing is, please avoid usage of antibiotics for viral illnesses. Antibiotics has got no role in influenza like flu viral illnesses. We have been seeing that there is a lot of antibiotic use going on, people taking antibiotics over the pharmacies and using it, and it is going to be a big problem of developing antibiotic resistance. So antivirals are available easily in the market. So any flu-like illness, especially during an epidemic like this, so antivirals are the best treatment of choice to be given for flu-like illnesses.
Sir, in this case, a lot of heart attacks are going.
See, the heart attacks cannot be attributed to a flu-like illness, especially influenza virus. So heart attacks usually we have been seeing nowadays, it's attributed to a different cause altogether because of various other factors that has to be looked on into. It is not because of influenza right now.
ఈ కారణాలు ఏంటి కరోనా వైరస్ తర్వాత ఇప్పుడు H3 ఎట్లా ఉండబోతుంది సార్ దీని ప్రభావం ఎంతవరకు ఉంటుంది?
See, coronavirus, had the ability to develop as a pandemic disease, whereas influenza virus will not develop into a pandemic-like situation. We can call it an epidemic-like situation, where infection is spread in a certain community during a particular time. So it can be called epidemic. It's not a pandemic. Especially corona-like viruses, corona illness usually affected all age groups. Even young people we have seen died because of coronavirus. Especially pandemic like illnesses, influenza virus will affect at-risk groups the most. And we have seen only till date 2 deaths attributed because of influenza virus this season. So corona has been a totally different virus. Influenza virus is a totally different virus. So corona can affect any age group. Influenza usually affects at-risk age groups, older population, pregnant women and children usually.
What are the instructions to the people?
The instructions for general public would be to avoid going to crowded places, use face mask and wash your hands regularly, and for following proper sanitary methods would usually help us in avoiding getting infected.
H3N2 is very serious or normal?
H3N2, has the propensity to develop into a fatal illness in at-risk groups. H3N2 is usually severe when compared to other subtypes of influenza viruses. Okay, thank you.